Welcome back to TV5 News at 9. Joining us this morning from Michigan Health Clinic is Dr. Tessa Dake. Thank you so much for being here today, Dr. Dake.
Thank you so much for having me.
You are welcome. Okay, Dr. Dake, today we're talking about the COVID-19 vaccine. So what are the latest updates on the vaccines in the Great Lakes Bay Area?
Yeah, so we've been very lucky. We have actually seen both Midland and Saginaw counties receive over 18,000 vaccines, and Bay County is at a close second at around almost 14,000 vaccines.
Wow, that's great news. So now that people are getting that second dose, what are we hearing about the vaccine?
Yeah, so we have been immunizing since December, so we're starting to see a lot of healthcare workers have their second round of the vaccine. So we're looking forward to increased immunity in that community. But we're also hearing that the second dose is a little rougher for patients. We're hearing that, in particular, the usual kind of fevers, chills, aches, and arm pain, instead of maybe lasting 12 to 24 hours, can be lasting a little bit longer. Some people are seeing 48 hours of that.
Wow. So, Dr. Dake, when can we expect the vaccinations to be available for the general public?
Yeah, so in the last week, we've seen rollouts to those who are 65 and older. Of course, we've seen partnerships trying to get out to long-term care facilities so the elderly and at-risk can also be vaccinated. So we're hoping in the next few weeks to months, we're going to start seeing that move on to the next categories of the population, so that way we can offer it more widely.
Sure. If people want to plan ahead, Dr. Dake, where should people go to get registered for the vaccine?
Absolutely. So most county health department websites have the ability to sign patients up, particularly those who are 65 and over, so the current category that we're vaccinating. However, if there's difficulty with access or people don't like using the internet, you can, of course, look to your local Commission on Aging, give them a quick call, and they can also help get you connected and signed up.
That's great. Anything else you'd like to add, Dr. Dake?
Yeah, I think at this point we're really looking forward to kind of seeing an improvement in our ability to kind of get out and socialize, but we of course want to make sure people are still social distancing and masking and washing hands, because until we reach at least a 70% vaccination rate in the community, we aren't going to see a real good decrease in the numbers or a good improvement in the immunity of the overall group. So we want to make sure that people have access to that vaccine, but also that they are able to get it, and then that way they're helping not only themselves, but those around them.
That is so important to remember that. Thank you again for joining us, Dr. Dake. We appreciate you joining us and stopping in today.
Absolutely. Have a great day.
You as well, Dr. Dake. And if you'd like any more information about this topic, head on over to the hot link section of WNEM.com.